Hi everyone, welcome back to my channel. This is Glenda Ganzon, and for today's video, I'm going to discuss health education, hygiene and sanitation, particularly with the negative impact of having a poor personal hygiene. So stay tuned. Poor hygiene is a sensitive topic, and talking to a person about it can be difficult. As a result, a person with poor personal hygiene could become isolated from other people. Because poor personal hygiene may also have an effect on the workplace, not just in the workplace, also in the educational institution, in your school, or anywhere. Companies may be more likely to offer jobs to those who appear to take care of their health and presentation, of course, and poor personal hygiene can be particularly problematic. There are also many health implications of having poor personal hygiene, and here are some of the following hygiene-related diseases. Number one is athlete's foot. Athlete's foot is a fungal infection that affects the upper layer of the skin of the foot, especially when it is warm, moist, and irritated. It is also known as tinea pedis and ringworm of the foot. The fungus that causes athlete's foot called trichophyton, and it is commonly found on the floors and in clothing. Athlete foots also, or the athlete's foot fungus, only infects the skin if conditions are right and it requires a warm and moist environment. For example, the inside of a shoe. Because of this, only about 0.75% of people who regularly walk about barefoot are affected. However, up to 70% of people will, and at some point, develop athlete's foot. Athlete's foot most commonly develops between the toes, and it usually causes burning, stinging, redness, and itching. And it also causes flaking on the skin in some other people. It is the most common type of fungal infection, although it is contagious. Athlete's foot can usually be treated with over-the-counter medication. However, individuals with a weakened immune system or diabetes should see a doctor as soon as the athlete's foot develops. The second one is the body lice. Lice are parasites that live on the skin. Most are harmless to overall health, but they cause tiny bites which can be bothersome. There are two kinds of lice. The first one is the chewing lice, which feed on the skin and debris, and sucking lice is the second one, which feed on the blood. Body lice are between 2 to 3 millimeters in length, and they are tan or gray in color, and they live in beddings and clothings and crawl onto the skin several times a day to feed. They tend also to bite areas of the body where the seams of the clothing come into contact with the skin, and these include the neck, the shoulder, the armpits, waist, and especially the groin. People with body lice may experience itching and rashes if they have allergic reaction to the bites, and some thickening or darkening of the skin may also occur after prolonged periods of infestation. Body lice are the most often spread of though close contact with infected individuals are more common in the areas with overcrowding and poor hygiene, and they can carry bacterial diseases including typhus, relapsing fever, and trench fever. though these conditions are rare except in the areas of extreme poverty. The third one is diarrhea. Diarrhea occurs when a person has loose or watery stools, and many different conditions have diarrhea as symptoms. And most people experience this common illness at some point in their lives, with short-term cases of diarrhea being the second most commonly reported illness in the country. A person with chronic diarrhea will typically experience runny stools for longer than 4 weeks. Acute diarrhea should not be a cause for medical concern. However, chronic diarrhea may cause other problems if a person does not receive proper treatment for it. There are many potential causes of chronic diarrhea, and some of the most common include drinking large amount of alcohol or beverages that contain caffeine, such as coffee or cola or soda, that can cause loose and watery stools. And when a person stops consuming these substances or starts to consume them in more moderate amounts, the symptoms should be resolved. The fourth one is tooth decay. Cavities are small holes in the teeth caused by decay, and several home remedies can prevent this decay or stop it before it forms a cavity. A build-up of food and bacteria form a film on the teeth, and the term for this is plaque. If plaque is not removed, it will cause tooth decay. Streptococcus mutans is a type of bacteria known to play a role in this tooth decay, and plaque builds up more easily in places such as the cracks of the teeth, pits, and grooves in the teeth, also in between the teeth and around the fillings, particularly when they are chipped or broken. Also in the close to the gum or gum line, and over time decay reaches the tooth decays or the tooth's inner layer, and we call them as the dentine. And at this point, a cavity starts to develop. If possible, to prevent cavity, using home remedies when decay is at the pre-cavity stage. This is when decay has made holes in a tooth's enamel but has not yet reached the dentine. And once the dentine decays and a cavity starts to form, professional treatment is necessary. The fifth one is the head lice, and they are small gray insects about 2 to 3 millimeters long, and they live on the scalp where they feed on human blood and lay eggs at the base of the hair shaft. The eggs of the head are commonly known as nits, and they are tiny and translucent. The empty eggshell are white, and they can remain stuck to the hair for up to 6 months. A person with a person is most likely to find them at the nape of the neck and behind the ears. The head lice do not transmit diseases, though their bites can occasionally expose the host to secondary infection. They lay around 6 eggs a day, and they are transmitted through the head-to-head contact and shared objects including brushes, headwear like ponytails, headbands, also in towels and pillows. So this ends the first part of this topic, the negative effect of having a poor personal hygiene, and I'll be talking more about this topic. We still have a lot of negative effect of having a poor personal hygiene in the part 2 of this video, so please watch the part 2 of this video, And if you like this video, please give it a thumbs up. Also share. And if you haven't subscribed yet to my channel, please do consider subscribing. Also hit the notification bell so that you'll be updated with my new videos. Once again, I would like to thank you all for watching this video, and if you have any question, please write it in the comment section down below and I'll be glad to answer them all. Thank you for watching. Bye everyone. See you on the part 2 of this video. Bye.